A few things we need to consider when we're taking shades. We don't want the patient to have any makeup on their lips whatsoever. You don't want reds or shiny things, just naked lips. If the patient is wearing anything bright, like reds or yellows or green, try to put a bave on it that is neutral color, maybe gray or light blue. All these colors around the teeth will make your brain confused, and it will make taking the shade much more difficult. At the same time, the light from the flash will hit those colors and come back with that hue, and we don't want that. From this position, I will take the shade at the beginning of the appointment. Teeth will change color as they get dry, and they do so very quickly. They get whiter. You cannot take a shade for an anterior case after you worked on the patient. It has to be the first thing you do. I'm going to ask my model, my wife, Colleen, to place the retractors. I have the patient hold the retractors, and I hold everything else. By using the Vita tab for the linear guide, the first thing I'm going to do is to find the value. And the number one mistake that people do is to take too long to do so. You have 5 seconds to find the value before your eyes start changing and you cannot discern difference in value anymore. So, very quickly, you're going to come down and find the closest value. Within 5 seconds, you should be able to disregard either the lower end or the higher end of this guide. And if you cannot do that, then you shouldn't be taking the shade. I have narrowed it down to 2, and I'm going to try again, another 5 seconds. The way I do this is by putting the shade tab in the same parallel plane as the teeth. It cannot be 45 degrees or it cannot be in front of it, because the light has to hit it the same way as it's hitting the tooth. On the Vita linear guide, you have from 0 to 5 when it comes to value. Once you have found which value level you're at, then you're going to get that tab with all those values, and you're going to choose chroma, color. So now that I know that Colleen is in value 2, I'm going to do the same, but now with the chroma within that set of values. Again, don't look at it for more than 5 seconds, and if you do, just come out and rest your eyes on something neutral, like a white or gray wall. Or you can look at this car, which is gray. It's like cleansing your palate between white tasting. Once I've narrowed down my selection of shades, I prefer to send to the laboratory not just exactly the one I think it is, but the one that is right before and after when it comes to chroma. So I take pictures with 3 tabs in the mouth. Now that I know, or I believe to know, what is the closest shade that matches her teeth, I'm going to take my first picture, making sure that I'm not overexposed or underexposed, and the first picture that I'm going to take is with the gray card. Many people will ask me if using a contraster behind the teeth and the shade tabs is better to communicate with the lab, because it will remove any distractions from the back of the mouth and the tongue. The answer is simple: no. You do not want to use anything behind the shade tabs of the teeth that is not present in real life. You want to have the picture with the background as it is in real life. The light will go into the mouth and hit the back of the mouth and come back. We do not need to alter that. We actually need to leave it as it is to capture reality. Do not use a contraster where you're taking your shade. The Flexi Palette set from Speedlight comes with this gray contraster. It's not really a contraster. It's a tool that can be used as a gray card while you're taking pictures. You can put it behind the teeth just like the contraster, and then in post-production you can color correct by using this. So you don't really need a gray card. You have it with the Flexi Palette set. There are many tools in the market that will help you narrow down the shade taking process. I use the Vita Easy Shade. I've been using it for a long time, since I was in the laboratory about 20 years ago. When I went to Harvard, I actually did some experiments on it, and I found it very reliable. Do I use the Vita Easy Shade for everything I do, including the anterior cases? No. But I use it almost 90% of the time to get me really close, and then I finish by using my eyes. I use my Vita Easy Shade for most of my chair-side restoration with the CEREC system or any other milling system that you have. If I'm doing posterior crowns and I'm milling them in-house, the Vita Easy Shade is really useful to get you there closer and faster, and it's very reliable. I will take the shade first, and I will grab that tab from the tablet and confirm visually. And I find that almost over 90% of the time, it is the same shade that I picked by eye. And I find that the other 5% that is not correct, it is so off that it's obvious. So that helps a lot.